Welcome to Living Aligned. I'm your scoliosis coach, Dr. Andromeda Stevens. Today, we're going to talk about overall wellness and sort of life beyond scoliosis care and all the other elements that can be sort of enveloped around your specific scoliosis care, whether that is that you've had surgery for your scoliosis, that you are wearing a brace, or you're out of your brace now, or you are an adult. Let's talk about some of the issues that come up and some of the things you could consider to sort of round out and improve your overall wellness living with scoliosis. So some of those issues can be nutrition. People ask about nutrition. Is there a specific thing going on with me that I should be worried about? And the answer is generally no. There's no real specific research that says that there is an item that you can point to with scoli. Some of the research will talk about melatonin a little bit and calcium, magnesium, but in general, the only way to know is for you to get tested. And there are simple ways to do nutritional tests. You can do saliva testing through laboratories. You can do blood testing with your doctor. So I would ask your healthcare provider about doing just a general nutrition, like a panel, and find out if you are deficient in anything that you could be working on. That might be a game changer in how you feel. And something that you might not have been supplementing that could be easily fixed. So nutrition definitely can mean, supplementation. For me, for my spine and a lot of for my patients, we just have some general joint pain and those things. And I'm not making a specific recommendation for you. You need to always consult with your physician first. That things that have helped for pain and inflammation have been turmeric, quercetin, glucosamine, MSM, those kinds of supplements. And we outline them all in my Scoliosis Coach Handbook. We talk about all of these issues and how they work within the body to reduce inflammation. So those are interesting things that you could look into. And what could be causing inflammation? What could be causing your pain? Well, we probably already know what those things are. You might have a wheat or a gluten intolerance, and that's creating an inflammation in your body. You need to find out about that for yourself through testing. But things that also cause inflammation in the diet are, strangely, tomatoes, potatoes, and eggplant. Those are night blooming fruits and vegetables that have a chemical that can irritate and cause inflammation in the body and aggravate your pain. Sugar, we know, at the top of the list. So you can clean up your diet with some simple little tweaks and make a big impact on how you feel. The next thing I would say right along in line with that would be water and staying well hydrated. Our joints are made out of water. All of the cartilage in our body needs water. We need a lot of water for our brain and for things to function. So being hydrated will make your joints much happier and you'll be more comfortable. So look into how much water you need daily. It's a simple calculation based on your weight. Google it, figure it out, and work on that. Ergonomics are important. Ergonomics mean, how do you sit? How are you at work? How is your chair? Where is your desk? Where is your computer? Are things angled properly? Are things at the right height? Is your chair appropriate for you? Making these changes. And we talked about some of these things in the podcast earlier about alignment, and that would be something you need to work on with your therapist to make sure that you're doing your alignment and your corrections for your curve specifically throughout your day. It'll make a huge impact on your comfort and your reducing your pain. Drugs for masking pain. I have a lot of people in my life who are very comfortable taking pain relievers all day, every day. And this is just masking the pain. This is not solving the root of the issue. So if you find that that's going on with you, I would invite you to talk to your doctor and maybe start to investigate how you could work on the pain naturally and not having to be taking pain medication. Certainly not good for you, not good for your kidneys, not good for some of these medications have other side effects. They can thin your blood. They can be just hard on your body. Some tools that you can use to manage your pain that are not necessarily cures for scoliosis by any means, but massage is amazing. We have definitely some tight areas of overdeveloped muscles and along with those weaker set of muscles. So getting massage with somebody who knows what they're doing will be delicious. Work on that. Chiropractic has been amazing for me when I'm really just in a state of being tight and in pain that I need to get an adjustment just to loosen those joints. Scoliosis will have spots that are very tight and the spine will get very stiff and sort of locked in those positions. Keeping a regular chiropractic adjustment would be wonderful. I wish that I could tell you that chiropractic care can cure scoliosis. There's no research that shows that that's the case, unfortunately. I would be a wealthy woman if that was true. I would adjust it away. I would be doing it all day. That would be amazing. But I'm sorry to say that that's not the case. So please don't follow some crazy recommendations of being seen 3 times a week for 3 months and expect some great results. Unfortunately, it's not going to happen. Acupuncture is amazing when you have a flare-up of pain. Can just sort of promote that overall sense of wellness. It's very relaxing and can be very beneficial. The research is actually better on acupuncture than it is on massage, strangely. So look into that. And lastly, meditation, right? Get your mind right. Learn how to tune it out. Get some you time and learn how to meditate. And if that involves utilizing some of the wedges that have been given to you by your Schroth therapist, I find that really unravels my spine. And by wedging, I mean in Schroth, we do wedging to sort of level out the spots of the body that are imbalanced. And these wedges are very simple. You're just lying on these wedges right on your back, on the floor, on your mat, and your whole spine melts. It feels amazing. So you need to learn how to do that. I would suggest that you look into doing wedging techniques when you're meditating. That will give you even more comfort, and you'll get more out of it. So now we're going to talk about our Mythbusters and dispelling some rumors. Some of the ladies out there are very concerned about pregnancy, that I'm not going to be able to get pregnant because I have scoliosis. I'm not going to be able to carry my child properly. That's not true. The research has shown that people who have scoliosis who either had surgery or didn't have surgery sort of ended up at the end of the road there at about the same functionality as each counterpart. So whether they were fused or not fused, they sort of end up with the same quality of life in general, and that includes the ability to bear children. No issue there. The only thing that you need to be concerned about is that when you're undergoing fertility treatment or when you are actually pregnant, you are secreting a hormone called relaxin, and that hormone is designed to relax your entire skeleton, specifically your pelvis, so that it will be easy to give birth. So when you give birth, this pelvis needs to open, right, quite a bit to let the baby through. So all these ligaments need to relax in the pelvis. So the relaxin hormone is designed to help that happen, but it's not specific to your pelvis. So all the ligaments of your body will relax. And if you have a scoliosis, those ligaments relaxing can cause an unfortunate progression of the curvature. I have some patients who have told me that when they were pregnant or undergoing hormonal fertility treatments, that they actually felt their curve getting worse. So it's a critical time to be working harder on your Schroth therapy or your scoliosis specific care to make sure that your curve doesn't undergo any magnification. This hormone stays in your body for quite a while after giving birth, especially if you're nursing. So you need to consider that period of time will extend a little bit past your pregnancy too. Thank you for joining us on season 1 of Living Aligned. I'm your scoliosis coach, Dr. Andromeda Stevens. We look forward to promoting season 2 and creating that for you. So please reach out to us with any of your topics or your questions. You can reach us at ScoliosisCoach.com, or you can reach out to Amazon to purchase my book, which outlines so many of these issues and more to help you along your journey for you or for your kiddo. So we wish you all the best, and we look forward to seeing you again soon. Take care.